Well, my name's Douglas Lewis, and I'm a physician neurologist at the Amarillo Diagnostic Clinic. And I've been here for about the last 18 months or so. Prior to that, I practiced on my own for about the previous 8 years. And prior to that, I was with a different group. So I've been very happy here, and we get to see lots of exciting things, including migraines. A headache is a fairly common neurological condition, and oftentimes is taken care of by a primary care physician. But neurologists will see many headaches that are more difficult to manage, and there are several different headache types. Migraines are a large majority of the patients that we see, and oftentimes they're troubled migraines or difficult migraines. And the more simple migraines are oftentimes covered either by the patient themselves or a primary care doctor, but a lot of times they'll refer them over for further care when they tend to occur more frequently. Migraine headaches are more common in women. They tend to be maybe a fairly severe headache in general, and they begin generally on one side of the head or the other. Sometimes they will be preceded by what we call an aura, or a sensory symptom of some sort, meaning that a lot of times migraine patients will have an aura, or a visual phenomena that occurs. It can be flashing lights, it can be narrowing of the vision to a tunnel vision-like pattern. Sometimes it can be loss of vision completely for a period of time. But there can be other things like tingling and numbness. There can be dizziness as an aura. There can be any sensory modality that you can experience can be a symptom of a migraine or a migraine aura. Once the aura is over, which is generally 30 minutes to an hour, it'll go on into the headache. The headache will generally start on one side or the other, as I said, and the pain is usually a throbbing discomfort. And if you were to look in the books, that would be the most common descriptor of a migraine. But they can probably come in any type, meaning pressure sensation, sometimes mixed in with throbbing, sometimes described as a pulsating type pain, as well as any other kinds of descriptors that there would be, but the most common being throbbing or throbbing sensation. Some patients will feel as if their eyes are moving or throbbing if the headache pain is in the anterior part of the head or face, but it is generally that type of discomfort. It can be quite severe. Nausea will happen with a migraine. Oftentimes it'll be accompanied by vomiting, but nausea is a very common feature of migraine and actually has to be there for the diagnosis. The incidence of the nausea makes people very ill, and that will keep them at home oftentimes. And that can happen even during the aura. So it can happen anytime during the headache as well as during the early part of the headache. And so it can be quite disruptive. Features of migraine are things that we describe as photophobia, which is light sensitivity, phonophobia, which is sound sensitivity, and osmophobia, which is smell sensitivity. And any of those things can happen as well during a migraine, and generally you have 2 or 3 of these symptoms. Oftentimes it can be just 1, but more commonly it's 2. Migraine generally will last usually more than 4 hours. It can sometimes last less, sometimes last more. But 4 hours is a good mark, and sometimes it'll last even a few days. But they're usually up by 72 hours. Once you start getting past that, it turns into something that's called status migrainosus, which is an ongoing migraine headache that lasts longer than 5 days. So sometimes those are more difficult to manage because they're gotten out so long, and people have already taken so many different medicines for trying to treat it. The migraine in general, we have had lots of breakthroughs in the last 20 years with regards to the things that we use for them. It had been that we would use blood pressure medications like propranolol or verapamil for the control of prophylaxis of headaches, trying to keep them less frequent. But now we use other drugs like anticonvulsants, such as Topamax. We have some other kinds of treatments that we use for prophylaxis. We just try to work it into the patient's lifestyle better that way. The use of amitriptyline or nortriptyline is also very common in this condition, as well as other antidepressants, but those are the two most common antidepressants that are used. And then in the 90s, there was the advent of using Tryptan medications, which would include the sumatriptan, which is Imitrex, and then the family of medicine. And if you use that early in the headache cycle, it would oftentimes relieve the symptoms. And it relieves both the nausea as well as the headache. So it can be very helpful for a person with migraines.